Well, thank you very much, Mr. Chairman. And Ms. Young, it's wonderful to see you again. So appreciate all of your hard work, and I very much support the budget that the President has put forward. We'd be happy to vote on it, so appreciate it. Let me first start, though, by saying that just like President Obama inherited the biggest financial crisis since the Great Depression and had to dig our country out of it, President Biden inherited a mess. He inherited a mess. Over 424,000 people died of COVID before he was even sworn in. And if there had been competent, responsible actions by the Trump administration at the very beginning, this would be a very different story for Americans. President Biden also inherited a $7 trillion increase in our nation's debt from just 4 years in the Trump administration. And he inherited a global economic shutdown that we have not seen in our lifetime that has led to supply chain breakdowns and prices rising. And as horrible as it is to see the inflation we have, I am not surprised, Mr. Chairman, to see when we're trying to get the economy going again, that this has happened. And I appreciate all the efforts on supply chains to get things up and going again, and our focus as a caucus to bring down costs. The President's budget builds on the strongest economy in decades, as you said, by making investments that will help create jobs, will lower costs for people, and reduce our deficit. So I believe this budget is worth celebrating. But unfortunately, I know Republican colleagues, as today, Mr. Chairman, will demonize the budget. So I think it's important to look at what the alternative budget proposal is that they will support from the Republican side. So our Republican colleague, Rick Scott, who is on the Senate Budget Committee, a member of the Republican leadership, has offered us with key pieces of a Republican budget. What would they do if they were in the majority? So under their plan, all federal laws sunset in 5 years. And of course, if you think about it, the implications of that are shocking. I mean, that would mean an end to Medicare and Social Security, an end to Medicaid, which provides health care coverage for 86 million Americans, including our seniors in nursing homes. It'd mean the end of the Veterans Administration, taking away all the health care and other support for people who served our country. Under this Republican plan, middle-class families would see their taxes go up $100 billion this year alone. In Michigan, 38% of my constituents would see a tax increase. And there's so much more in here. I could go on and on. You know, President Biden has a great expression that I think is fitting for today. He says, "Show me your budget and I'll show you what you value." And through his budget request, we know President Biden's values and Democratic values on who we're fighting for. And thanks to Senator Rick Scott, the head of the Senate Republican Campaign Committee, we also know what Republican colleagues value. So let me now turn to the specifics in the budget. This president has proposed the largest increase in support for mental health and addiction services ever since President Kennedy signed the Community Mental Health Act in 1963, which was his last official bill signing. And so I want to say thank you to him through you. Thank you for working with me. Thank you for working with Senator Blunt and I on our bipartisan efforts to expand community behavioral health clinics across the country, evidence-based, bipartisan efforts now being fully implemented in 10 states. And I want to thank you for expanding this across the country. It's so needed, and certainly COVID has shown us the incredible needs that families have. So, Ms. Young, could you talk more about why the budget proposes a nationwide expansion of this bipartisan program?
You have 30 seconds to do it.
With 30 seconds, I want to thank Senator Stabenow, Senator Blunt for their tireless efforts to address what really is a crisis, the mental health crisis. The budget proposes reforms to health coverage I spoke about earlier and makes major investments to the mental health workforce. This comprehensive set of proposals will improve access to mental health treatment and strengthen the mental health provider workforce to respond to what is absolutely a crisis.
Thank you. Thank you, Mr. Chairman.
Thank you very much.